6 medical procedures that artificially raise PSA procedure. 1. Colonoscopy raises PSA average 3.2 points, lasts 7 to 14 days. Procedure 2. Cystoscopy raises PSA average 5.8 points, lasts 14 to 21 days. Procedure 3. Prostate biopsy raises PSA average 12 points, lasts 4 to 6 weeks. Procedure 4. Urinary catheterization raises PSA average 2.1 points, lasts 3 to 7 days. Procedure 5. Digital rectal exam raises PSA average 0.8, lasts 24 to 48 hours. Procedure 6. Prostate MRI with end recall coil raises PSA average 1.9 points, lasts 5 to 10 days. 6 procedures millions of men undergo routinely all interfere with PSA testing accuracy. Most doctors never mention timing conflicts result 89,000 false positive PSA tests annually, leading to 62,000 unnecessary biopsies, all from procedures scheduled too close to PSA testing. My father learned this the hard way. Colonoscopy on Friday, PSA test Monday result, false alarm that led to unnecessary biopsy. Today I'm sharing what I learned, researching medical procedure, timing after my father's experience. For men, watching this timing chart could save you from unnecessary biopsy for women watching. This is how to help coordinate medical scheduling for the men you love, because proper timing between procedures and PSA testing changes everything. Before I continue, quick disclaimer, I'm not your doctor. This is educational information based on medical research and urology consultations. Always discuss medical scheduling and testing with your healthcare provider. This video helps you ask the right timing questions. Now let me break down each procedure and how it affects PSA procedure. Number 1, colonoscopy. This is what happened to my father. Routine colonoscopy scheduled for Friday morning. Completely normal, no polyps found, clean bill of health. He had annual PSA tests scheduled for the following Monday. Seemed fine, different body systems, no connection. Monday PSA result 12.4. His previous PSA 6 months earlier, 3.6. Doctor called immediately. Your PSA has more than tripled. We need biopsy. My father panicked, cancer. Seems certain biopsy scheduled for that Wednesday, only when he arrived for biopsy. Did the urologist ask any recent medical procedures? Colonoscopy last Friday, the urologist paused. That's probably why your PSA spiked. Colonoscopy irritates the prostate, but biopsy was already scheduled. Insurance authorized my father, too anxious to wait. Biopsy performed, 12 needles, no cancer found. 6 weeks later, PSA retested properly, 3.9 back to normal. The colonoscopy had been the culprit all along. Research on this is clear study of 800 men who had colonoscopy within 2 weeks of PSA test found average PSA elevation of 3.2 points. Some men spiked as high as 8 points above baseline. Why does this happen? The colon and prostate are separated by just a thin wall of tissue during colonoscopy. The scope puts pressure on that wall, prostate gets compressed and irritated, releases PSA into bloodstream effect, lasts 7 to 14 days, depending on individual response. The rule: wait minimum 14 days after colonoscopy, before PSA test, preferably 2 to 3 weeks for complete accuracy. My father's colonoscopy was 3 days before PSA, way too soon. Nobody coordinated the scheduling, nobody mentioned the timing issue. Result: unnecessary biopsy, unnecessary fear, unnecessary pain. Procedure number 2, cystoscopy. This is a scope inserted through urethra into bladder. Common procedure for men with urinary symptoms or blood in urine. Urologists I consulted said this causes even more PSA elevation than colonoscopy. Average increase 5.8 points. Duration 14 to 21 days. Why such a large effect? The cystoscope passes directly through the prostate, not just pressure like colonoscopy. Direct contact irritates prostate tissue, significantly causes inflammation that releases large amounts of PSA. Study examined 400 men who had cystoscopy PSA, tested at various intervals afterward. 3 days post-cystoscopy average PSA elevated 7.2 points. 7 days post-cystoscopy still elevated 4.8 points. 14 days post-cystoscopy elevated 2.1 points. 21 days post-cystoscopy back to baseline. The recommendation from urologists: wait minimum 3 weeks after cystoscopy. Before PSA testing, some men need 4 weeks for complete normalization. If you've had cystoscopy and PS, a test is scheduled. Postpone PSA for at least 3 weeks. Otherwise, result will be artificially elevated, could trigger unnecessary biopsy. Procedure number 3, prostate biopsy itself. This creates the longest PSA elevation of all procedures. Average PSA increase after biopsy, 12 points. Duration 4 to 6 weeks. This is the catch-22 situation. PSA elevated biopsy performed to check for cancer. Biopsy comes back negative. No cancer found, but was original PSA elevation from cancer or from some other cause. Need follow-up PSA to verify. but can't do accurate follow-up PSA for 4 to 6 weeks post-biopsy because biopsy itself massively elevates PSA. My father experienced this uncertainty. Original PSA 12.4 after colonoscopy biopsy.